The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction. My first guest is an expert on the topic, board-certified plastic surgeon, Dr. Lagrasso. Dr. Lagrasso, welcome to the program.
Thank you for having me, Randy.
So what's changed in the last 10 years with liposuction?
There's been significant changes in liposuction, probably the most changes of any of the plastic surgical procedures. There's been a variety of new technologies that have emerged on the market. New ones are coming out, all the time. Everything is based upon the traditional approach of, where we're injecting a saline solution. And we're pretty much, the basis of liposuction is that you're removing fat from an area using a cannula.
Okay.
And, over the last 10 years, we've seen significant changes. There's been lasers that have been introduced to attempt to melt the fat and to theoretically tighten the skin. There's been ultrasound-assisted technologies, kind of like what we use, the Vaser,
okay.
Which uses an ultrasound probe to melt the fat. And people have been doing that. First, they've been trying it externally, and now we'd actually do it internally. And there's radio frequency waves that have also been used to attempt to melt the fat. The whole theory behind it is that, we're trying to come up with better ways to get the result with a better patient satisfaction and a faster downtime, get you back to work faster than the traditional ways of liposuction.
Okay, now we talked off camera, and even my perception is that everybody's doing liposuction the same way. Is that a frustration of yours? You think that's common, a common thought, that liposuction is liposuction?
Liposuction is definitely not liposuction.
Really?
I mean, first of all, there's a lot of different subspecialties doing liposuction. You have plastic surgeons doing liposuction. You have, internal medicine doctors. You have dermatologists. Everyone's got different training and different philosophies. I got to be honest, liposuction is probably one of the most difficult operations in plastic surgery.
Is that right?
To me, it's the second most difficult operation behind rhinoplasty.
So nose surgery, nasal surgery.
Nose surgery is by far the most difficult.
Why is this so tough, liposuction? I mean, it seems very straightforward. Respectfully, I say.
It seems like it. The theory behind it is you remove fat from an area, but the body's not a flat surface. It's not that easy. People want you to create a certain look and a certain image. Your goal in doing the procedure is to create a curve. So think about it. You're using something to remove the fat from the body to create a shape, but if you do that incorrectly, it could be a disastrous result.
Okay. Now I talked to the other. One of the other plastic surgeons that work with your company, and he says, Randy, we have these almost like secret protocols for great results, like a certain way you approach liposuction. Elaborate on that.
Yeah, we developed
It's called Smooth Sculpt. Is that it?
Exactly. It's called Smooth Sculpt. It's kind of Sleek's proprietary protocol. We kind of developed it. One thing Sleek has is that we all have board-certified plastic surgeons in all of the locations.
All right.
So you're only going to be treated by someone who's got the proper credentials, nobody else. And, one of the foundations of Sleek is that they want to bring to you the most advanced care. So we got together and we thought, what's the best way that we can get the best result for the patients? And this is what we came up with.
Which is?
Smooth Sculpt.
All right.
And, what it is, it's a combination of several different factors. It's a preoperative, operative, and postoperative protocol. The first thing that we do is we kind of want to get the fat ready to be removed. So we use an external ultrasound device, which kind of loosens up the fat.
So this is the day of the surgery?
This is the day of the surgery. This is about, depending on what areas you're doing, and every patient's a little bit different, between 15 and 30 minutes prior to the procedure, you're going to get the preoperative portion of the Smooth Sculpt.
Okay.
And what we're doing is we're actually taking an external ultrasound, we're putting it all over the areas to be treated, we're warming up the tissues, which is loosening up the fat, and it's kind of helping get the fat ready to be dissolved a little bit faster.
Okay.
And then afterwards, then we do the operation. Now, what we're doing in the operation, we're using the Vaser, which is an ultrasound-assisted probe.
So this is with a small instrument, cannula.
Very small instrument.
Goes in there, and it's doing what?
We're making 2 to 3 millimeter incisions. They're tiny. They're about this big. They're inconspicuous once they're healed. We actually insert underneath the skin, through all the fat, this ultrasound device, and it shoots out ultrasound waves.
So it's like heat? Is it hot?
It does get warm. You
Okay.
can feel it, when you have your hand on the skin, the skin does get warm, but it's actually emulsifying the fat so that when you remove it, it's like putting melted butter on popcorn.
Really? Not an overstatement.
You can see the difference in the cannulas that we remove.
Okay.
You know, when you do traditional liposuction, it comes out in little clumps. This, it comes out nice, smooth, just like melted butter.
Interesting. Okay, so I get this correct. Okay, so with your protocol, you start with this external ultrasound.
External ultrasound
to
first.
break up the fat a little bit. Then you go in with a small cannula to the area.
Internal ultrasound.
And then you break up the fat, like melt it.
We melt
Is that
it.
right? And then you go in with traditional liposuction.
Exactly.
And then remove it.
It's not traditional liposuction in the old sense. The cannulas that we're using are a lot smaller because the fat's already broken up, so that you don't need a large enough cannula to remove the fat. We can use smaller cannulas, which, you know, limits all the bad side effects that you can have when doing liposuction. You know, one of the main side effects of liposuction, the one that you don't want to get, is creating concavities and divots. And typically that was due to.
Is that really a problem, though?
It is.
It can't happen?
It is.
I don't see it.
You don't see it because those are the people that, you know, hide from the liposuction. You're not going to see them at the pool. You're not going to see them at the beach. Those are the ones who are wearing the shirt. You know, we've all seen the pictures of the celebrity who had liposuction, who has all the wrinkling of the skin on her stomach. You know,
Or the bumps, yeah, okay.
the bumps,
I
exactly.
gotcha.
You know, you can get the bumps, you can get the dimpling. You know, these are all the things that you want to try to prevent. And using our,
That's in the hands of the surgeon.
it's in the hands of the surgeon, but it's also, you can limit that by using some of the technology that we have. And by using the Smooth Sculpt, that's the whole process of it. We want to give
everything's
you.
about smooth. I mean, we talked on the telephone.
is.
You, smooth result. You want to make them look good naked, not just great in clothes. It implies that, I guess it's not always smooth. So that's
Exactly.
what you're trying to do.
You know, and what do people come in with?
Okay, good.
You know, when people come in for the consultation, they say, you know, I got a little bit of irregularity here, the skin on my thighs a little bit uneven. So they're pointing out the things that aren't smooth to you. You know, they want to be smooth. They want the smooth contour. They don't want to be lumpy. They want to be proportional. They want to be curvy. They don't want to be uneven. You know, that's the whole purpose of why people are coming in.
You know, I think people need to know this, and for people just tuning in, it's a real interview, okay? Nobody is scripted here, but we're talking about the next generation of liposuction for smooth, great results, board-certified plastic surgeon here, but that not all surgeons like doing liposuction. I have guys that, you know, when we were looking for people to come on the show, it's like they don't like to do it. It's tedious.
It
You
is.
know? Why do you like to do it?
You know, one, liposuction is very tedious. I mean, at the end of the day, I'm exhausted. You know?
Really? You have to be in shape to do it?
Yeah, you have to be. It's like going to the gym. I don't have to go to the gym when I get home because I do all the work when I'm at work. You know, I keep my fat off by taking other people's fat off.
Is it in all the areas of cosmetic and plastic surgery, is this one of the happiest group of patients?
It is. You know, people in general are happy from aesthetic surgery, but people are very body focused. And with liposuction, you know, you can treat multiple different areas of the body and get a result. So you can get, you know, instantaneous changes to something that was making them unhappy for years.
Okay. Now it's still the most popular procedure,
It still is.
and it's safe. It can be safe.
It's, you know, in the proper hands, in the proper facility, with the proper doctor, you know, liposuction is a very safe procedure. You know, the risk of anything bad happening is very low. It's less than 1%. But, you know, there are people out there who aren't really trained to do liposuction, and they're doing it on people that they shouldn't be doing it on. And that's
So
where you can get problems.
men and women, who, I mean, is it more women than men?
I would say about 70 to 75% of our patient population is women, and then the remainder is men.
Okay, we're going to take a quick break. We come back. I'm going to take me through the process of something that goes in, you know, for their abs and their flanks, and how soon they could get back to work and what they can expect. You're watching the Wellness Hour, leader in medical news and information. We'll be right back.
I am so thrilled that I had this procedure done. My confidence is great, and I'm just happy and ready to get back into that bikini that I've always wanted.
Again, gave me more self-confidence. I'm happy with the results. I don't feel like I have to hide anymore behind my clothing.
I had thunder thighs. And I will always get teased since I was a little girl that I had thunder thighs.
I liked dressing up, like being beautiful, and with the weight, it's like, okay, I'm not that beautiful because I had the weight on me. So when the weight basically started to come down, I felt like, okay, now I can go shopping and I can buy a smaller size. And when I started to notice that I can fit in sizes that I was not able to fit into in like 5 years, I was actually excited.
I have a 9-year-old son, and I had some extra baggage after having him that bothered me over the years, so I decided to get rid of it. I work out a lot, and I wanted to see optimum results.
So after lipo, I don't have to focus on all those stomach exercises anymore, and my stomach looks great.
Every time I wore a shirt, I felt like I was wearing my daughter's t-shirts because you could see the fat below the bra line. So I'm so happy with that also, because I think a woman's back is very important, that if it's slim, because that definitely ages you when you do have fat hanging from your bra line.
I will definitely wear a bikini now on the beach, and I wouldn't have done that before.
Sleek Med Spa gave me the results that I've always wanted to get back into that bikini.
2 months after the procedure, I was able to buy new clothes that fit. I went down a couple of sizes, and I'm not as self-conscious about the clothes that I wear now. It's really exciting. I really like that part of it.
Number one area of the body, and we'll start there.
Both men and women, stomach, the sides, the flanks, lower back.
Okay.
That central abdominal area.
Okay, so after pregnancy maybe, you know, who's the best candidate then for this smooth sculpt?
You know, there's no.
Now, what do you do?
There's no one best candidate. You know, we treat people of all ages, people who are in their late teens, early 20s, up to people in their 60s, 70s. You know, we people who are thin and people who are overweight. You know, we can make a difference in almost every patient population, and you know that's the good thing about it. You know, and that's what people will need to know. It's not just for the person who is, you know, extremely thin and fit. You know, we can do different things with that. You know, we can really sculpt those people.
Can you give a six-pack?
You can give a six-pack.
Is that right?
And that's one of the most common things that men come in for. You know, a lot of men will come in and they say, you know, I've been working out, I'm dieting, I'm exercising, but I just can't get over that hump. You know, my abs are there somewhere. I feel them. I can feel the bumps, but I can't see them, and they want to see them. You know, they want to get that V-shaped torso. They want to get that etched abdomen. You know, they want to look like the guys on the Muscle and Fitness magazine.
Okay,
you know, that's what they want. You know, especially nowadays. You know, especially being, you know, I'm in South Florida. It's sunny all year round there. You know, people want to look good. They're going to the beach. They're going to the pool, and not only that, but you know, people are wearing tighter clothing. You know, women are wearing shorter shirts. They're wearing tighter clothes, tighter dresses, form-fitting things. You know, that's all in style nowadays. I mean, you look at all the celebrities. You know, they all look good. And let's be honest, that's not all natural.
Something's going on over there. Okay.
Something's going on.
If somebody looks too good on the abs and they're over 40, maybe they've had something done.
Well, not even over 40, but you know, people are getting things done at an earlier age.
So with the procedure, let's talk about abs and flanks. Typical female, you know, are they? Is it after pregnancy? Are they in their 30s? I mean, who is the?
I would say that there's two classes of the typical female. The first is the ones who are in, you know, between 20 and 30, who don't have children, who just have a little bit of a pooch that they want to get rid of. They want to look better in their bathing suit. That's the most common.
What about diet and exercise? I mean, shouldn't they do that first?
When people come to us, they've already done diet and exercise. It hasn't worked. There's a genetic predisposition for certain people to retain their fat in certain areas. A lot of people retain their fat in their stomach, in their flanks, and they just can't.
So no matter what they can do,
they could be in shape in the rest of the body, but they just have fat surrounding these areas, and that's, you know, those are the best candidates for liposuction.
So on day one, what do they say? Okay, so we're abs and flanks. Do they ask the same questions? Do they have the same fears?
Yeah, I mean, everyone has a standard thing, but the main thing is they want to look good.
Okay.
You know, they want to look good in their bathing suit. They want to look good in their dress. They want to look good in their lingerie. You know, that's the main thing. You know, they want that smooth abdomen. They want that flat abdomen.
Is everybody asking questions about laser liposuction and all these different names for liposuction?
Get it all the time. I got to be honest with you. I've used every different form of liposuction that there is available to us today.
Okay.
I've used the lasers. I've done over 100 cases with them. I don't use them anymore. I don't
Interesting.
You know, the theory is that you're going to use a laser to melt the fat, and all of a sudden, this skin is going to shrink wrap to the form that you created.
All right.
It just doesn't happen. It just doesn't work. I've not seen the results. You know, great
Good for
concept,
marketing,
but the technology's not there. We're not there yet. We have a long way to go.
Do you think, you know, of course, you're on the program, and, you know, I probably know the answer, but do you think that your protocol is about the best available for the best results when it comes to liposuction?
I think
with what you're doing?
In this point in time today, that the Smooth Sculpt protocol by far will give you the best results.
Because you want it all done, I mean, one time, right? Just like you say, nasal surgery, you got one shot to get a great result.
Well, the reason you want it done the first time right is because, one, if you have to go back in there, it's much more difficult. It's a lot easier to get it done the first time than have to correct something that's been done incorrectly the first time.
Okay, we're going to take a quick break. You're watching the Wellness Hour, leader in medical news and information. We'll be right back.
I was even surprised. There was no discomfort. I mean, I knew that that's what everybody said they were experiencing, but I was like, oh, there's got to be something. Week 1, 2, 3, 4, I mean, it just got better and better and better. I mean, every day was exciting. I was like, I'm gonna put these pants on. Off I go to Cabo, and there I am. I'm eating in the restaurants in my swimsuit. I'm out on the beach in my swimsuit. And you know what? I felt taller. I felt better about myself than I ever had. I actually only had one itty bitty bruise.
About 3 days after my procedure, I could see an amazing difference right away. I was so excited. I had a flat tummy I never had probably in the last 6 to 7 years since having my little boy. And I knew it would do nothing but improve.
Just putting on a pair of shorts yesterday, they were quite loose on me, and it's a very nice feeling.
My back, which was also done, is an incredible result. And my waist, where it slims down, is amazing.
I'm really enjoying the fact that when I look in the mirror, the new face that I see looks a lot more like the face I had 10, 15 years ago. People keep asking me, you know, what's different? And everybody asks me if I've lost weight.
I've just had so much fun with it. I've worn a 2-piece swimsuit, which I haven't worn in probably 6 years.
I work on my boat with my shirt off now, whereas before I would never consider it. I was inhibited. Now that's gone.
How soon could they go back to work? Okay, so we're talking about the woman, you know, she just can't get rid of these love handles, ab, fat, you know, couple days, 3 days, back to work?
Yeah, I mean, most people are back to work within 2 to 3 days. I had a gentleman that I just operated on a couple of weeks ago. He's a chef. We did his man boobs. We did the operation on a Tuesday. He was back to work on Thursday. And this is a person who's constantly moving his arms and chest and cooking for everybody, and he had no problem.
Now, you say that little areas that you're surprised how it really holds people back, that it can bug them. Like this guy with the man boobs.
Mm-hmm.
I mean, do they tell you on the consult, like, you know, I never go shirtless, or?
In his case, you know, I just saw him recently 2 weeks after the operation. He said it was so easy that he wished he would have did this 10 years ago when he initially thought about doing the procedure.
Do they say this a lot?
All the time.
Like I should have done this long.
You know, this is a guy who came in the consultation, said that, you know, he always hid himself, always wore a shirt at the beach, always wore a shirt at the pool, you know, never liked to be...
Is that right?
Never liked to be exposed in his chest, and now he feels comfortable. And this is only 2 weeks after. You know, I mean, he looks good already, and he's going to even look even better in another couple of weeks.
Does it give them leverage to start eating better, exercising more?
Well, you know, that's the best case scenario which happens with people. You know, you want them not only to look better, but you want them to motivate themselves to be healthier and live a healthier lifestyle. So that way they can look even better. You know, with the liposuction, you'll see changes in their body. They'll feel better, they'll feel more self-confident, and in most people it does, you know, they make that jump to not only looking better, but now we're gonna start living better. We're gonna be healthier.
Do they dress differently on the console, like 2 weeks later, they come in? I mean, do you see changes like that in them?
You do, you do see some changes. You usually see that a little bit, you know, longer down the line than 2 weeks, but you know, people feel better. So when you feel better, you dress better. You get that glow about you. You know, you're living life with more confidence.
So you could hit the six-pack, the flank area. Let's talk about the women for a second. For people just tuning in, we're talking about the next generation of liposuction. Okay, you call it smooth sculpt. You have some, I'm calling them secret protocols you use at Sleek, and everybody's doing it the same way, by the way.
Yeah,
all your companies are stretched.
Exactly. Even though we're stretched up and down the East Coast, you know, we're in constant communication with each other, and we're using a standard protocol.
Okay.
Because, you know, and we want to get the best result for the patient.
So with the abs, okay, so the day of the surgery, take me through that again, and then we're going to take a quick break.
So day of the surgery, about 15, 20 minutes prior to beginning the operation, hit you with an external ultrasound, loosening up the fat, helping to get it nice and warm so that we can remove it easier. During the operation, we're using the Vaser internal ultrasound, melting the fat, removing it, coming out like butter.
Okay.
Then afterwards, about 1 week after the operation, we're hitting you with another type of external device, but this time we're using 3 different heads. We're using the external ultrasound again, which is also helping you to heal faster. We're using a lymphatic head, which is, you know, helping to promote the drainage of all the swelling and so forth. So get rid of all the swelling faster, get you back into shape faster. And then we're using a suction device, which is actually making sure that you get a nice smooth result. It's augmenting the result that you already have.
And it's not always done like this, by the way? I mean, it's rarely done like that, using these protocols?
Very rare. You know, I practice
And do you
all
get better
over.
results, though? I mean, do you really think?
You really do.
I tried to get it out of you off camera, behind the scenes. I go, do you really think you get better results? And you said yes.
I 100% believe it. It's amazing.
So right before you do the traditional lipo, I'm calling it traditional lipo, but before you do the lipo, you hit it with this radio frequency under the skin.
Ultrasound.
Is that right? Ultrasound under the skin. Melts the fat.
Exactly.
And it comes right out. And then you do the post-op like a week later.
Yep.
Interesting, interesting. And you do this while they're awake.
We do it while we're awake.
That's,
exactly. You know, like
why? Why? I mean,
well, it's easier for the patient. You know, I mean, people are scared of anesthesia. Everyone always says this. They don't want to do anything with anesthesia. I'm afraid of anesthesia. I'm afraid of anesthesia. I'm afraid of anesthesia. You know, all liposuction is typically done under general anesthetic. You know, it's a longer downtime. There are some risks of general anesthetic.
What about results, though?
The results are better.
Why?
Because we can position the patient. When you're doing it under general anesthetic, the patient's like, they're asleep. They can't help you with moving. When we do it under a local anesthetic, and we give them some medication to, you know, make them a little bit relaxed because we want them to feel comfortable.
So they're not in pain during the procedure, obviously.
No, it's like when you go to the dentist. You go to the dentist and he fills the cavity or works on your teeth. He gives you the shot of Novocaine.
Yeah.
You know someone's working on you, but you're not feeling any pain.
Okay.
We do the exact same thing, except that we inject a saline solution underneath the skin, which surrounds the fat, which has lidocaine in it. It's a numbing agent. So during the procedure, you're going to feel a little pressure. You know I'm doing something. That's why we give you the pills that make you a little bit relaxed, but you're not going to feel anything. You're not going to have any discomfort.
Okay, now, all types of areas, and we're just about out of time, but the legs, the buttocks, the thighs, the neck, the chest, the bra strap area, it works for all those areas.
It works
knees,
great.
Chubby knees.
You can sculpt the entire body. You can sculpt the neck, the jowls, the chest, the bra area, you know, abdomen,
arms. How
outer
well do
thighs.
arms treat?
Arms treat great. You know, a lot of women come in, they're wearing sexy dresses these days, you know, they're in their bikini, they got a little bit of some flab on there, maybe, you know, you haven't lost all of the little bit of flab from your pregnancy, and you want to just have a tightened, more toned arm. You know, use the smooth sculpt, tighten it right up.
Is that right?
Get you back into that dress.
And it doesn't come back, right? I mean, it doesn't come back.
It doesn't come back.
Those fat cells are gone forever.
No, you're born with a certain number of fat cells, and when you remove them in an area, they don't come back.
Okay, we're going to take a quick break. More questions about the process and what you're doing for safety. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about Smooth Sculpt, the next generation of liposuction. We'll be right back.
I couldn't wait to go out and get a bikini. That was like, you know, I wear a belly shirt now, or, you know, a sports bra rather when I go to the gym. I don't have to wear so much clothes, and it motivated me to work out more, to really like just change my whole body. I've lost 25 pounds since then.
Right now I went out and I bought 3 new bikinis. I have that bikini on and I run right out there. I'm showing my stomach off all the time. I love it. It's beautiful.
I don't have to worry about anything that I try on. Everything fits. I don't have to worry about anything hanging over. I can pretty much wear whatever I want. I'm really excited that summer's coming up. I'm gonna be going to the beach, not have to worry about anything. It just makes me feel a lot more confident.
Oh, I am so happy right now. It's the best thing I ever did. I feel very comfortable in all the clothes that I wear. I don't have to worry about my arms flapping in the wind. I don't have to worry about wearing a tight top, a loose top anymore. I can wear whatever I want. When I go shopping, I can pick and choose whatever shirt I want, and it's like the greatest thing I've ever done. I am so happy with Sleek Med Spa.
After I had the lipo, I was able to return back to work the next 2 days, basically. So I basically took 1 day off of work and was able to return back to work as soon as possible. There was no downtime at the lipo. So it was really great.
I'm very happy. I got to do things finally that I never done before, like wearing a bathing suit, my skirts.
It's just, my confidence is through the roof. I just feel so much better about myself. I think, you know, physically just feeling confident and happy about my body has kind of spilled over into all other aspects of my life, so I'm really happy.
I felt the results were much better than I had possibly have imagined. It was wonderful to get up and see a flat stomach. It was great.
My husband is really happy.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the next generation of liposuction. With us, we have an expert on the topic. He is a board-certified plastic surgeon. We're talking about Smooth Sculpt. Okay, for people just tuning in, we're talking about this protocol for smooth results with liposuction. Give us a recap of what you're doing. Okay, so even on the abs, you do the pre-care, the day of the surgery.
The pre-surgical, immediately before surgery. You got the surgical treatment, and then you got the post-surgical care.
Okay.
And all of these things are tied in together to give you the best results, the smoothest results, hence the name Smooth Sculpt.
And you're able to get, do you think you're able to get more fat with the technology that you're using than just standard traditional liposuction?
Definitely. I mean, not only can you get a better result in the easier treated areas like the stomach, where the fat's not too entrenched into the surrounding tissue, but in the harder areas, such as the back, the bra area, where the fat...
Is that a common area, by the way, the back, bra strap area?
Very common area. You get women who come in there, and when they put their bra on, they got these rolls of skin and fat that hang outside of it. Looks horrible.
Okay.
And they want to fix it. You know, they don't want to be lumpy, bumpy around their bra.
They tell you they hate it?
They tell you they hate it. Very common area. Very common area.
Okay.
But the fat there is hard to get out because there's a lot of fibrous tissue in the fat in the back.
For
And
most guys, it's hard to get out. Not for you, right?
No.
No, I'm kidding.
The phaser is a tremendous tool for it. You know,
Okay.
the ultrasound technology breaks it up so that we can remove it easier, which in turn gives the patient a better result.
So they get to wear the clothing they want.
Exactly.
Look good, things like that. And so this is a case of self-esteem. You know, I like what you said at the break, that it's not for everyone.
It's not. It's not for everyone. But if you have an area that's bothering you, that's been bothering you for how many amount of years, that you tried to diet, you tried to exercise, still there bothering you, this is the treatment of choice. I mean, liposuction is the answer. We can treat that area and get that sexy contour that you want. I mean, that's what people want. That's what, you know, that's the goal.
I want to thank you for coming on the show. Very interesting.
Thank you very much.
Good for you. And your photos, things like that, are all on your website?
They're correct. SleekSurgical.com.
Check it out. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you can go online and do a search on our website for Dr. Lagrasso or Sleek or liposuction. He'll pop right up. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.